Okay, next speaker is from McGill, KC, and he will talk about in vivo mapping of cortical excitation-inhibition imbalance in temporal lobe epilepsy.
Hi everyone, thank you for being here. I'm from McGill. Today I'll talk about excitation-inhibition imbalance in temporal lobe epilepsy. I have nothing to disclose. Epilepsy is one of the major neurological disorders. My work focused on temporal lobe epilepsy. It's one of the most prevalent drug-resistant epilepsy in adults. It's characterized with high prevalence, high disease burden, and recurrent epileptic discharges, in addition to hippocampal atrophy and hyperintensity on MRI. Patients with epilepsy also suffer from psychological, social, and cognitive impairments, such as memory and language. The causes of temporal lobe epilepsy is very complex, but the classical or prevalent view is excitation and inhibition imbalance. This theory is strongly supported by a bunch of in vitro and invasive animal studies. My work aims to map regional ER imbalance using in vivo and non-invasive technology in human beings. Earlier work validates the husband derived from temporal neural signal can be an excellent proxy of ER ratio. Specifically, as ER ratio increases, husband decreases. So I'll use this measure to do my work. In our work, I include two datasets from MRI and Mexico with multimodal MRI and comprehensive cognitive assessments. I computed the response from resting state function MRI for each individual and each brain. Here we can see the higher ratio in the fugue area, such as the temporal lobe and the insular and the medial prefrontal cortex, and the lower ear ratio in the lateral prefrontal parietal and occipital area. When comparing to health controls, we observed higher ear ratio across the whole brain, especially in the bilateral temporal lobe, prefrontal cortex, and occipital. When looking at the longitudinal data, the ear ratio is further higher at the follow-up time point against the baseline time points. And the ear ratio, the higher ear ratio is also associated with the lower or hypometabolism. Next, using biophysically informed computation modeling, we are able to profile the microcircuit parameters such as the recurrent connection and external inputs from a structure connectome. We observed increased recurrent connection and decreased external input in TI patients compared to health controls. And more importantly, we found the significant correlation between recurrent connection abnormality and ear ratio change. Then, individual brain region is organized into the largest signal networks as the spatial smooth. Then we can assume the connected area at both the structural or connectivity level are more affected by the pathological. Here we found the strong correspondence between node abnormality and the neighbor abnormality at both structure and connectome, and both structural and functional connectome levels. Then using connectome and statistical reference, we can see the the strong epicenters as the middle temporal lobe and the lateral prefrontal cortex and the postparietal areas in epilepsy. Finally, we check the association between cognitive and the disease severity with the EI ratio change. We can see the higher EI ratio in patients with longer epilepsy duration and lower cognitive function in terms of MoCA and EpiTrack. When looking at the longitudinal data, we can see the EI ratio change is associated with the MoCA change. And these findings are well replicated in independent cohorts. Overall, we observed higher and diffuse EI ratio in adults with temporal lobe epilepsy, which can reflect recurrent hyperconnection at the microsecond level and can be used to inform potential epileptic epicenters and predict prospective cognitive decline. Final, I'd like to thank my supervisor, Dr. Boris Barnhardt, and my awesome colleagues and collaborators and all volunteers. Okay, thank you.
So now we have some time for questions. There's already one in the app asking how reliable is the Hurst exponent as a measure of EI ratio? How reliable is the measure?
The reliability?
Yes.
Okay, this is a very good question. But we have to check it. In our work, the findings are well replicated in an independent cohort, but I'm not sure if the reliability of this measure.
Mm-hmm. Okay, it's okay.
Yeah, that's actually, I have a similar kind of follow-up question is, how was the Hurst exponent measured? Like what method did you use to actually measure the Hurst exponent in the fMRI time series?
Sorry?
What method did you use to estimate it, the Hurst exponent?
Resting state function MRI time series.
Sure, did you use a detrended fluctuation analysis or an autocorrelation function, or what was the way that you got the actual value of the Hurst exponent?
The wavelength.
The what? I'm sorry.
The wavelength transform.
Wavelength. Okay, thank you.
Yes, yeah.
Perfect. Yeah. So, and I think that you were doing it on the time series. I've done some similar stuff in EEG, and so we've noticed that you can look at the Hurst exponent of amplitude modulations over long periods of time, and we were noticing that the correlations and these long-range temporal correlations in the data drop off at around anywhere from 60 to 100 seconds. So in an fMRI time series, are you seeing similar timescales since it's on more of a slower signal that's more on on the scale of seconds that you're measuring?
Yeah, we analyze the exponent using the whole time series. We don't do the we have to check, but it's a good point to check the dynamic.
Yeah.
Of the
so I guess what kind of windows sizes were you using?
Yeah,
in
we
your
use the whole time series. Yeah.
Okay. Yeah. Thank you.
Yeah, you're welcome.
I've got a similar question. I mean, the whole study rises and falls with this Hurst coefficient, right? I've just looked at both of the references on your slide. I just can't find the Hurst coefficient in those papers. Maybe I got the wrong slide or something. Can you briefly explain how you get a measure of excitation over inhibition across the brain from MRI?
Yeah, we use the Hurst exponent as a proxy of EI ratio. We cannot exactly analyze the excitation and inhibition. Now it's a ratio. Yeah, the Hurst exponent is a proxy of EI ratio. Yeah.
But based on what? Normally people measure excitation and inhibition based on GABA tone or TMS measures. So how do you get this from MRI?
Yeah, this resting as we collect the data during the rest.
Okay, thanks.
Okay, thank you so much again. Very nice.